topic I'm presenting today is okay, patient safety and clinical communication, which is not considered to be a very important topic, but research data proves it to be a very important thing to consider. The concept of patient safety, what exactly is patient safety, right? Okay. WHO defines patient safety as the prevention of errors and adverse effects to patients associated with healthcare. It's a new healthcare discipline that emphasizes the reporting, analysis, prevention of medical errors. Why does communication break down? Different communication styles. Our juniors communicate differently, consultant differently, nursing staff, ward boys, all have different styles. High level of activity. The level of activity, high level is a comparative term. Everybody considered it differently. Frequent interruptions. Everybody has his own power. Interrupted frequently. Somebody is sleeping for 6 hours, somebody 8 hours, needs frequent breaks. Others, more frequent workers, sleep for only 4 hours, more active. No standardization in organization, essential information, no standard performer or to take over or give over from a coming resident or leaving resident, loss of information, which we consider it unimportant, doesn't bother to give it or pass it on to the other coming resident or the junior or senior. What can go wrong? Everybody wants to do good. We all know that. Everybody wants to do good. Nobody wants to harm anyone, especially our patients. The problem is that the things are not getting cleared. Okay. Purpose of action didn't happen. Decision was not reached. Physician, registered nurses, communication differences due to training, practice, style of communication, past experiences, level of empowerment, tone of voice, and level of respect. Okay, nurses are not telling us too many things as they are respecting our residents. If the resident is going to do something wrong, they are not communicating to consultant. They all got silent. After all these things, at the end, patients suffer. Key approach to improving patient safety is improving communication. Juniors communicate well to seniors, seniors communicate well to staff, nurses. Everybody should communicate properly. And truth is the basic rule. You should accept your negligence and your problems to deal with patients. And we should have some tool to standardize the things. It should not be haphazard. Communication handoffs. Nowadays, IS bar is an effective tool for all types of communication handoffs. What is IS bar? Identify yourself and the patient, situation, what is the problem? You should understand the problem, information of the contextualize the problem. You should have a background, why the patient is here and how he is right now. Assessment, your clinical assessment and prediction should be good. Recommendations, what you think should happen. This is a chart, it's a performer, and sorry. Okay, it's a performer. Very comprehensive performance include a situation, background, assessment, recommendation, and decisions. It should be properly handed over to the coming resident, to the leaving resident, should fill it properly. Test is a test tool, and we should first of all try it in our environment, in our culture, in our hospitals, and we can do some changes if we want to, according to our culture, our environment. but should have a standard thing all of the time. Why should we care? As I already mentioned, is a proven thing. Institute of Medicine estimates up to 100,000 patients die in US hospitals annually due to errors in their care, failures in communication leading cause of adverse events in healthcare, issues around communication, continuity of care or care planning cited as a root cause in more than 80% of reported sentinel events. We discuss about sentinel events also. Australian review of 28 hospitals found communication errors associated with twice as many deaths as clinical inadequacy. Okay, what is sentinel events? Unanticipated event that results in death or serious physical or psychological injury to a patient and is not related to the natural course of the patient's illness. The top of the sentinel event is the communication. Main cause of sentinel event is communication on the top of it. Components of ideal handoffs should be brief one, but should be precise. Should be written how sick is the patient, significant past medical history of the patient, reasons for admission, why is here, current condition, recent intervention, active problems should be mentioned in proper way. Components of ideal handoffs, systemic approach to communicating needed information like SBAR should be systemized. Everything should have systemic approach. Contingency planning, that is anticipated problems, results, procedures, and what to do about them. Always be specific on each of your theory, each of your writing which you have in your SBAR. Feedback to verify a shared mental model. What we want the mental model means a two-way communication between the two persons. The sender paints a picture, relevant items, specific directions with the rationale. Check receiver how he understands his picture. What the receiver should do, he should listen properly, ask questions, use system to remember important items, and read it back what he has given. How to summarize? Okay, giving, sign out, be specific, concise, and deliver the information in a standardized form. You should have performer should have some standardized format. Receiving sign out, summarize what you were told and ask questions as needed. Listen actively by anticipating potential issues. Read back again and again. Communication, poor communication can lead to errors, near misses, and adverse events. Good communication can improve quality and safety of patient care. Okay, efforts and courage are not enough without purpose and direction. Should have a proper direction. Okay, thank you.